Greetings and welcome once again to another episode of Caring for You with me, Dr. Terence Drew. Today we are going to speak about a very important topic, although it is deemed a very common one, and that is hypertension or high blood pressure. I chose to speak about this topic today because over the last year there has been significant changes with the criteria to diagnose high blood pressure or hypertension, and that has implication in person's health and well-being. So what is hypertension or high blood pressure as it's commonly called? It is where the blood pressure is above what is considered to be normal. About a year ago, it was considered to be where the top blood pressure would be 140 or more, or the bottom one would be 90 or more. The top one is called the systolic, and the bottom number is called the diastolic. However, that has changed. And now, high blood pressure or hypertension is considered to be when the systolic or top number is 130 or more, and the bottom number, the diastolic, is 80 or more. With just that simple change, our country here, St. Kitts and Nevis, has increased its population of persons suffering from high blood pressure or hypertension significantly by approximately 15-20%. Why is it so important to know about hypertension or high blood pressure? It is because, one, it is very common here in our country, in the Caribbean, and among Western blacks. Secondly, it causes significant complications such as stroke, heart attacks, kidney failure, among others. But these three complications are life devastating, life changing, and in many cases lead to death. So how do you diagnose blood pressure? Every person, even children, especially in the Caribbean, should have their blood pressure checked by his or her physician. And we use what is called the sphygmomanometer, which is this piece of instrument here. As you can see, it has a cuff. It has this piece where we look at the blood pressure. This is a manual sphygmomanometer. We have the automated ones, which I use frequently in this office. But sometimes I go back to this because it is very, very accurate. And so for adults 18 and older, if the blood pressure is 130 systolic and above, the diastolic 80 and above, and more than one occasion where you come into the doctor's office, you would have rested for some time, you would not have eaten, smoked, or drunk coffee, or have any psychological stress, or take any type of stimulant that can increase the blood pressure, and have your blood pressure checked in the seated position. And on 2 or more occasions, it is noted that the blood pressure is elevated. And then you are diagnosed as being hypertensive. Now, how can we prevent hypertension? We can prevent hypertension by doing very simple things, such as exercising at least 150 minutes per week. That can include aerobics, such as walking, and here a lot of people walk along the street. That can include swimming, biking, playing a sport, or even going to the gym and doing weights. But whatever you choose, so that you get at least 150 minutes per week on separate days. The other thing that you can seek to do is to have at least 10,000 steps per day. Some people put on a watch-like instrument, it's called a pedometer, and this measures how many steps you would have taken during the day, and you aim for 10,000. That too has been shown to help to lower blood pressure. You must also strive to have an appropriate diet that we call the DASH diet, which means you have nuts, lots of fruits, vegetables, low fat, meats, and if you consume any animal product, preferably fish, you have low fat dairy. These are some of the things that must be a consistent and fundamental part of your diet in order to help to stem hypertension. And so that word I use is DASH, D-A-S-H. And so you can look into that type of diet frequently. You should rest to ensure that there is decreased psychological stress. You should strive for at least 7 to 8 hours of sleep per day. That has been shown to decrease the incidence of high blood pressure, or risk of getting high blood pressure. Even if you have high blood pressure, that is a means of controlling blood pressure. You should seek to also do relaxation techniques, listen to music, go to the gym, hang out with friends, get a spiritual life. These things have been shown to help to lower stress and therefore can help to deal with hypertension or high blood pressure. Now, once you're diagnosed with high blood pressure, all that I've just mentioned you can employ. In addition, you can also be put on medication. And there are different types of blood pressure medication. Some of the most common ones are the ones we call the water tablet. Some people might take it and feel good about it. Others complain that they have to go to the bathroom too often. But the water tablet helps to flush salt and water from the body and helps to control the blood pressure. There's another group called calcium channel blockers, which is a group that works very well in black people, such as the amlodipine and nifedipine and so forth. We have those that are called the beta blockers, those are called the ACE inhibitors. But what we are saying is that we have different classes of high blood pressure medication, and your doctor will determine which one is most appropriate for you. But what is important is that once you are placed on medication, you should follow the doctor's orders and not stop your medication at your convenience. This can be very dangerous. I've seen patients who are on their medication stop their medication, and all of a sudden they suffer a stroke, heart attack, acute kidney failure, because their blood pressure elevated very high and resulted in a devastating complication. So I want to admonish you to make sure that you take your medication. As I end this program today, I want you to know that high blood pressure or hypertension is not a death sentence. People live many, many decades with high blood pressure once they would do what is necessary to ensure that the pressure doesn't rise. And once you would have carried out this, lose weight and so forth, you can be a healthy person whether or not you have high blood pressure. And so I want to say to you, live well, eat well, exercise, keep the weight down, keep away from heavy salted food, keep away from excessive amount of alcohol intake, stay on the diet of lots of foods, lots of vegetables, control your stress levels by finding time to relax and enjoy the lighter side of life. And if given medication, follow your doctor's orders. And I can almost guarantee that these simple measures can give you a healthy life despite high blood pressure or hypertension. Just want to say thank you for joining me, Dr. G, for another episode of came over for you.